Thank you so much for joining us here on 10 Tampa Bay at 5:30. I'm Courtney Robinson.
And I'm Josh Sidorowitz. First, though, a new year, new concerns about a new COVID variant, although most of us are probably sick and tired of hearing about it. 10 Tampa Bay's Eric Lasser explains why public health workers say this latest mutation is something that we all need to be paying attention to.
It's a spinoff of some of the earlier Omicron variants.
The latest coronavirus mutation is called XBB.1.5. Dangerous, say public health workers, because it appears to be getting past our defenses.
At least in a laboratory dish, it was able to escape antibody responses from previous infections and from the vaccine itself. Doesn't mean those two things are going to be useless. It may be, but that's still protective against hospitalization and death.
The variant has been spreading like wildfire, with a combination of holiday travel and get-togethers likely fueling it. Originating in the U.S. Northeast, it now accounts for about 75% of that region's active COVID cases.
This guy is homespun. It's come out of New York and Connecticut, were the first places that it was actually detected.
The Twitter sphere has been blasting the CDC for failing to update the numbers as the variant spread over the holidays, citing data allegedly leaked to a Harvard epidemiologist, even going so far as to accuse the government of intentionally withholding the info to keep the economy buzzing during a busy shopping and travel season.
I wouldn't point to any conspiracy theories without any data. You know, we don't know. If it comes to light that that's the case, that's pretty egregious. So I hope not.
What health workers do know to be true is that XBB.1.5 is likely to infect a lot of people quickly. That could crowd hospitals, but so far severe illness has been limited. The smartest things folks could do, say health workers, is to break out those masks again, especially indoors and around large groups.
Temporarily get the mask back on, take care of yourself, so be safe, and then this too shall pass.
In Tampa, Eric Lasser, 10 Tampa Bay.
So while this new variant accounts for 3 out of 4 cases in the Northeast, it's closer to 40% nationwide, but that number is expected to climb quickly.